Some Medicare news here in Greenville, South Carolina that may influence you if you are a patient of a physician or want to utilize the facilities of Bon Secours Health, and if you're on UnitedHealthcare's Medicare Advantage plans. Right now, they are playing a little game of chicken, and this happens sometimes when an insurance company and a hospital system are both trying to split up the pie. You know, who's going to get the most money out of the deal, right? So they're both playing a big PR game right now. This may or may not get resolved. Right now, the contract is set to expire July 1st. What this means for you, if you have UnitedHealthcare Medicare Advantage plans, let me be very, very clear. We are not talking about Medicare supplement plans. You're fine. But if you have a Medicare Advantage plan with UnitedHealthcare and this agreement doesn't get hammered out, and that you could lose access to the Bon Secours system, meaning they would no longer be in network. So if you are on a PPO plan, which are plans that allow you to go outside of network, you'll still be able to use Bon Secours, but you'll pay a little bit more to do so. If you're on an HMO plan, you will be totally on your own to see those physicians or use the Bon Secours health system. This illustrates one of the big dangers of the Medicare Advantage plan, right? You are limited to the network, and networks can and do change. It really stinks when they change mid-year, because this can really put you in a lurch. If you've got care scheduled, if you've got physicians you want to keep going, if you've got a procedure coming up you may have to put off, it's kind of a danger. Now, that is why if you go with the Medicare Advantage plan, I strongly suggest to my clients that we use a PPO plan so that you at least get some out-of-network benefits if something like this happens, okay? We help people with Medicare in Greenville all the time, and one of the things we always want to do is run through your doctors, the providers that you need to see and make sure they're in network. What can you do if you're in a situation where you may lose where you may lose Bon Secours? Really not much. You can postpone care, you can utilize it out of network. You're not going to really have any recourse to change plans right now unless you fall into some other specific situations that we can get into. But it is something to know as we approach the enrollment period for next year. Something you're going to want to be aware of and be thinking about. I'd love to talk to you. If you need help, have questions, you can hit me in the comments or at the link in my bio.